Hi, welcome to our channel of IGNOU Audiobooks, Indira Gandhi National Open University, School of Continuing Education, SOCE, Master's Degree Programs, Master of Science, Food Nutrition, MSCDFSM, Revised, Second Year, MFN 005 Clinical Therapeutic Nutrition, Unit-7 Nutrient and Drug Interaction, 7.1 Introduction. Modern medicine has given us many useful drugs that not only prolong and save lives, but in fact improve the quality of our lives. Have you ever thought that the beneficial effects of the drugs that we take can be affected by some of the foods in our diet? Many drugs have powerful ingredients that interact with the human body in different ways. Diet and lifestyle can sometimes have a significant impact on a drug's ability to work in the body. Certain foods, beverages, alcohol, caffeine and even cigarettes can interact with drugs. These food and drug interactions can have dramatic, even dangerous effects on the way our bodies react to drugs. The purpose of this unit is to present the most common food and drug interactions to see that we get the best results from the drugs that we need to take. Objectives. After studying this unit, you will be able to define nutrient-drug interactions, describe the effect of nutrients and food on drugs and the effect of drugs on the nutritional status, identify the clinical significance and risk factors associated with nutrient-drug interaction, and list handy guidelines for safe and wise use of drug. 7.2 Nutrient and drug interaction. Basic concept: medicines can treat and cure many health problems. Nevertheless, do you recall your doctor advising or recommending certain medications to be taken with food whereas others on an empty stomach? Have you given a thought as to why this is being advised? Well, this for the simple reason that medicines can be affected by the food we eat. Well, not all medications are affected by food, but many can be affected by what we eat and when we eat it. Sometimes, taking medications at the same time we eat may interfere with the way our stomach and intestines absorb medication. Other medications are recommended to be taken with food. A food-drug interaction can occur when the food we eat affects the ingredients in a medication we are taking, preventing the medicine from working the way it should. Some nutrients can affect the way we metabolize certain drugs by binding with drug ingredients, thus reducing their absorption or speeding their elimination. For example, the acidity of fruit juice may decrease the effectiveness of antibiotics such as penicillin. Dairy products may blunt the infection-fighting effects of tetracycline. Antidepressants called MAO inhibitors are dangerous when mixed with foods or drinks that contain tyramine, beer, red wine, and some types of cheese. So then, can you now define or explain what we mean by drug-nutrient interaction? Drug-nutrient interaction includes specific changes in the process by which a drug is absorbed, distributed, metabolized, and eliminated by the body, caused by a nutrients, or changes to the kinetics of a nutrients caused by a drug. In fact, nutrient-drug interaction is a broader term that also includes the effect of a medication on nutritional status. Nutritional status, you may already know, refers to the condition of health of an individual as influenced by the utilization of nutrients. Nutritional status may be impacted by the side effects of a medication, which could include an effect on appetite or the ability to eat. Hence, a study of these interactions is important as it enables the healthcare professionals and patients to work together to avoid or minimize problems. The benefits of minimizing drug-nutrient interaction, you would notice, would go a long way in ensuring medications achieve their intended effect: continuity of the prescribed drug by the patient, fewer nutrient or caloric supplement is required, optimal nutritional status is maintained, disease complications are minimized, and cost of health care services is reduced, the extent of the effects of any food and drug interaction can vary. Potential effects depend on the dose and the form in which the drug is taken, pill, liquid, etc. It also varies with an individual's age, sex, body weight, nutritional status and specific medical condition. The number of potential food and drug interactions is almost limitless. Interaction problems most often occur with the use of diuretics, oral antibiotics, anticoagulant, blood thinning drugs, antihypertensive drugs, thyroid and sodium compounds, and alcohol. Generally, administering oral medication along with the food or at a mealtime is a convenient manner of drug dosing. However, drug interactions can occur that modify the activity of the drug, decrease or increase drug effects, are referred to as drug-drug interactions, or impair the nutritional benefit of certain food, are called as a drug-nutrient interaction. While the effect of food or a nutrient on a drug or medication is a nutrient-drug interaction, the most commonly observed type of drug-food interaction affects the drug absorption. Such interactions raise concerns that medications may lead to nutritional deficiencies, or a poor diet may change how a medication works. This does not mean that if one is taking a medication, one needs to use a vitamin and/or mineral supplement. There is a little chance that taking a medication for a short time, such as a 10-day treatment, will affect the nutritional status. However, use of some medications for months or years may affect the nutritional health. Drug and nutrient relationship can be categorized into two aspects. 1. Effect of nutrition on drugs, the influence of nutritional factors on drug absorption, action and effectiveness, and 2. Effect of drugs on nutrients, the influence of drugs on nutritional intake, metabolism, excretion and requirements. We will study about these interactions in the subsequent sections. We will also briefly review the drug and drug interactions. So let us get started. We shall begin first with effect of nutrition on drugs. 7.3 Effect of nutrition on drugs. Pharmacokinetics is the study of the time course of a drug in the body involving the absorption, distribution, metabolism and excretion of the drug. The movement of the drug through the body during absorption, distribution, metabolism, etc. can be influenced by food or nutrients in the diet. These influences are reviewed next. Food's effect on drug absorption. The pharmacological effect of a drug depends on the rate and extent to which it is absorbed from the gastrointestinal tract. Food can decrease a drug's rate of absorption and/or increase the extent of absorption of numerous drugs. Examples include penicillin, tetracycline, TCN. The possible reasons for this may include delayed gastric emptying, altered gastrointestinal pH, competition for binding sites with the nutrients, adsorption or the adhesion of food or a food component, chelation, combining of drugs by food cations, and dietary fats impeding the absorption of hydrophilic drugs. Gastric emptying may be delayed by the consumption of high-fiber meal and meals with high fat content. Chelation reactions occur between certain medications and divalent or trivalent cations, a positively charged ion, such as iron, calcium, magnesium, etc., and the absorption of the drug may be reduced by chelation, combining with one of these metal ions. To illustrate, the antibiotic tetracycline form insoluble complexes with calcium in dairy products, thus preventing or reducing the absorption of both drug and nutrient. Adsorption is another mechanism by which drug absorption is slowed or reduced. An example of this mechanism is the cardiovascular drug digoxin, which should not be taken with high phytate food, such as wheat bran, oatmeal, etc. the presence of food in the stomach enhances the absorption of some medication. Drugs whose absorption increases when taken with food include drugs such as spironolactone, griseofulvin, and itraconazole. With some drugs, this food-drug interaction may be utilized to achieve higher serum drug levels or to use lesser amounts of drug per dose. For example, administration of the drug ketoconazole with acidic beverages such as colas leads to increased and prolonged serum levels for the drug. This mechanism is based on changes in the gastrointestinal pH. Generally, these interactions have an insidious onset and may not be clinically evident except for the failure to achieve the therapeutic goals of therapy or loss of disease control. Continuous, long-term monitoring of patients is needed when drugs and food must be taken together. An example to substantiate this aspect is as follows. The calcium in milk and milk products such as yogurt and cheese decreases the absorption of certain antibiotics, including tetracycline. Therefore, these foods should not be eaten at the same time this drug is taken, so that the full dosage of the drug is available for adequate treatment of the infection. Tyramine is a vasoconstrictor that raises blood pressure. Significant ingestion of high tyramine food, such as aged cheese and cured meats, by individuals while being treated with monoamine oxidase inhibitors, MOI, an antidepressant, can cause a hypertensive crisis such as increased heart rate, flushing, headache, stroke, and even death. Caffeine in foods or beverages increases the adverse effects of stimulant drugs such as amphetamines, methylphenidate, causing nervousness, tremor, and insomnia. In addition to affecting absorption of drugs, food can interact with drugs in a variety of other ways. These are highlighted in Box 7.1. Box 7.1 Other examples of drug-food interactions. 1. Vitamin K found in green leafy vegetables, tomatoes, coffee, beef liver, green tea, etc., and some non-prescription vitamin mineral products can antagonize the anticoagulant effect of warfarin, resulting in decreased anticoagulant activity and lowered prothrombin time, PT. Laboratory blood tests. 2. Vitamin B6, pyridoxine, found in avocados, beans, peas, sweet potatoes, bacon, pork, tuna, and some non-prescription vitamin mineral products, increases the metabolism of levodopa, producing decreased blood levels of dopamine and antiparkinsonism effects. We will learn more about this later in Unit 17. 3. Calcium, magnesium, and aluminium found in food supplements or antacid compounds bind chelte with ciprofloxacin and tetracycline to form an insoluble complex, resulting in significantly decreased absorption of these antibiotics and decreased antibiotic effect. 4. Calcium in vitamin mineral products and liquid enteral nutritional supplements interact with some fluoroquinolone antibiotics and with phenytoin, reducing their bioavailability and resulting in decreased antibiotic activity and loss of seizure control, respectively. Next, let us review the effect of food on drug transport in the body. Food's effect on drug transport. Many drugs are transported in blood bound to plasma proteins. Severe malnutrition or diseases affecting the synthesis of plasma proteins, such as liver disease, may reduce the body's ability to transport drugs and hence impair their effectiveness. Albumin is the most important drug-binding protein in the blood. Low serum albumin levels, due to inadequate protein intake and poor nutrition, therefore, provides fewer binding sites for some highly protein-bound drugs such as warfarin and anticonvulsant phenytoin, which may lead to risk of excessive anticoagulation and bleeding or toxicity, respectively. Next, we move on to the effect of food on drug metabolism. Food effects on drug metabolism. The general tendency of the process of metabolism is to transform a drug from a lipid-soluble to a more water-soluble compound so that it can be handled more easily by the kidneys and excreted in the urine. Food can both inhibit and enhance the metabolism of drugs by altering the activity of the enzyme systems operating in the body. To illustrate, scientists discovered that grapefruit contains natural substances that can affect the way certain prescription medications are broken down, metabolized, by an enzyme known as CYP3A4, cytochrome P453A4. This means that if a person drinks grapefruit juice and takes drugs such as felodipine, Zocor, orally, more of the drug may enter the bloodstream than would have under normal circumstances, resulting in a greater pharmacologic effect and possible toxicity. Factors which affect the deactivation or conjugation of a drug can thus alter its pharmacological or toxic effects. Periods of short-term starvation or prolonged periods of nutritional inadequacy can influence the effectiveness or safety of drugs. The amount of a drug required to produce a certain pharmacological effect is determined by the body weight. Sudden reduction in weight or dehydration may therefore result in overdosage. Undernutrition also reduces the activity of microsomal drug metabolizing enzymes, and this can diminish a drug's effectiveness by reducing its rate of excretion. These are additional reasons for ensuring nutritional adequacy during illness, particularly since this is when pharmacological drug use is most likely to be needed. Alcohol, which is also a drug in its own right, often affects microsomal enzyme activity and can potentiate the action of some hypoglycemic drugs or central nervous system. CNS depressants. The action of certain drugs such as propranolol may be reduced by alcohol. Certain nutrients can also have a direct influence on drug metabolism. Vitamin K reduces the anticoagulant effect of warfarin, and the dosage has to be sufficient to counteract the effects of habitual vitamin K intake. Any significant alteration may necessitate adjustment in warfarin dosage. Sodium intake inversely affects serum levels of the mood stabilizer lithium carbonate, and since this drug has a narrow range of therapeutic effectiveness, dietary sodium intake must be kept to a constant level in patients receiving this treatment. Next, we move on to drug utilization. Food's effect on drug utilization. The following illustrations highlight the effect of food on drug utilization. Liver and green leafy vegetables can decrease the effect of anticoagulants, blood-thinning drugs. These foods contain vitamin K, which helps promote blood clotting. On the other hand, aspirin and aspirin-containing compounds can enhance the effect of the blood-thinning drug and promote excessive bleeding. One of the most hazardous food and drug interactions is between monoamine oxidase MAO inhibitors and aged or fermented foods. MAO inhibitors are used to treat depression and high blood pressure. They decrease the metabolism in the body of compounds called monoamines. MAO inhibitors can react with a substance called tyramine, a monoamine, in foods such as aged cheese, fava, beans and others. As a result, blood pressure can rise to dangerous levels, causing severe headaches, brain hemorrhage and, in extreme cases, death. Natural licorice contains a substance which can increase blood pressure when eaten in large amounts. Long-term use of licorice and licorice-flavored candy or drugs can counteract the effect of medication used for treating high blood pressure. Finally, let us review the effect of food on drug excretion. Food effects on drug excretion. Food and nutrients can alter the reabsorption of drugs from the renal tubes. Urinary acidity affects drug reabsorption from the renal tubules. Hence, a change in urinary pH by food may change the amount of drug existing in the non-ionic state, thus increasing or decreasing the amount of drug available for tubular reabsorption. Supplemental intakes of nutrients. which increase urinary acidity. Example, large amounts of vitamin C intake can decrease the excretion of salicylate drugs such as aspirin. In our discussion, so far we focused on the effect of food or nutrients on drugs absorption, utilization, metabolism, excretion, etc. Let us now move on to the effects of nutrient supplements on drugs. Effect of nutrient supplements on drugs. A nutrient or nutrient supplement can alter the pharmacological action of a drug by enhancing the drug effect or by opposing it. These can result in drug-nutrient interactions. To illustrate, warfarin is an oral anticoagulant that reduces the production of vitamin K-dependent clotting factors by inhibiting the conversion of vitamin K to a usable form. Because this is a competitive interaction, the ingestion of vitamin K in the usable form supplement will oppose the action of warfarin and allow the production of more clotting factor. Therefore, to achieve an optimal level of coagulation, a balance must be maintained between the dose of the drug and the ingestion of vitamin K. On the other hand, ingestion of other nutrients like vitamin E in doses greater than 400 IU may enhance the anticoagulant effect of warfarin. Enhancement of the anticoagulation effects of warfarin may lead to serious bleeding events. Further, in excessive amounts, vitamins and minerals act like drugs instead of nutrients. Nutrients in excessive amounts may interact with other nutrients or may even be toxic. For example, large amounts of zinc can interfere with copper and iron absorption. Similarly, large amounts of iron can interfere with zinc absorption. Effect of feeding method on drug availability. The form in which a drug is administered or enters the body can influence its absorption, metabolism or excretion. This becomes more pronounced among critically ill patients who cannot consume drugs orally and are on enteral food support. If the drug has to be administered through the enteral feeding tube, it needs to be either crushed or dissolved in a solvent. Crushing oral preparations to pass down the tube may alter their absorption time activity. Some of the drugs cannot be added to the food infusion as it may alter their stability. Several drugs are available only in the form of tablets or capsules. Dissolving these in feed, water, alcohol or sorbitol may not always be feasible. Drugs such as cimetidine, aluminum hydroxide, metachlorpromide are physically incompatible with enteral foods. Certain drugs like phenytoin form complexes with calcium and protein, thereby resulting in markedly reduced absorption of this medication. Such drugs need to be given only by stopping enteral feed infusions for 1 to 2 hours. Patients on total parenteral nutrition generally have a separate tube catheter for infusion of drugs. Toxicity overdosage of drugs is frequently observed in case of certain drugs administered directly into the blood. With this, we end our study on effect of nutrient on drugs. Next, we shall explore the relationship between drug and food and the impact of medication on nutritional status. 7.4 Drug effects on nutritional status. Drugs can affect nutritional status in a number of ways, i.e. by enhancing excretion of certain nutrients, by interfering with nutrient absorption, or by decreasing the body's ability to change nutrients into usable forms. These effects are gradual so that the effects will be greater in persons taking drugs over a long period of time. For these people, vitamin and mineral deficiencies may result. Here are some examples of drug effects on nutrients in the body. Abuse of antacids can lead to phosphate depletion. This can lead to a vitamin D deficiency in severe cases. Some patients have developed osteomalacia or softening of the bones due to loss of calcium because of a vitamin D deficiency. The excessive use of diuretics, water pills, may result in the loss of electrolytes, mainly potassium. This may put people with heart problems at higher risk for serious heart rhythm problems. People taking diuretics regularly should eat foods which are good sources of potassium: tomatoes, tomato juice, oranges, orange juice, bananas, raisins, prunes, potatoes, sweet potatoes and winter squash. Women who take oral contraceptives over a long period of time may develop folic acid and vitamin C deficiencies if their diets are inadequate in these nutrients. The best sources of folic acid are spinach and other greens, asparagus, broccoli, and lima beans. Excellent vitamin C sources include oranges, grapefruits, lemons and limes, strawberries, tomatoes, potatoes, cabbage and green peppers. Anticonvulsant drugs, prescribed to prevent seizures, can lead to vitamin D and folic acid deficiencies. The use of vitamin supplements by patients taking these drugs should be medically monitored. The antihypertension drug hydralazine can deplete the body's supply of vitamin B6. This vitamin is widely distributed in foods. Some good sources are chicken, fish, liver, whole grain breads and cereals, egg yolks, bananas and potatoes. Consumption of these foods should be encouraged. Several drugs, including colchicine, used to treat acute gout, oral antidiabetic agents, and the antibiotic neomycin can impair absorption of vitamin B12. Persons who do not eat any animal products, vegans, may have poorer vitamin B12 status and may be at greater risk for a deficiency when taking one of these drugs. It is, therefore, evident that use of certain drugs can lead to deficiency conditions and poor nutritional status. It is also common to find that certain drugs cause altered taste or dysgeusia, change in appetite, have gastrointestinal effects, and some may lead to organ system toxicity. We shall review these changes briefly next. Drug effects on food intake. Food intake may be reduced because of drugs which have an anorexic effect, either as a direct effect of the drug on appetite, example, some antibiotics, or because of side effects such as drowsiness or lethargy, example, tranquilizers. Drugs can suppress appetite, leading to undesired weight changes, nutritional imbalances, and growth retardation. Most central nervous system stimulants, including amphetamine mixture and methylphenidate, suppress appetite or cause frank anorexia, cause nausea and vomiting. This is a common side effect of many drugs, particularly the antineoplastic drugs used to treat cancer. Affect the gastrointestinal tract. Gastrointestinal irritation and ulceration are serious problems with many drugs. You may be aware that nonsteroidal, anti-inflammatory drugs, NSAIDs, such as aspirin or ibuprofen often cause stomach irritation, indigestion, heartburn, gastritis, ulceration and sudden serious gastric bleeding. Other drugs may produce gastrointestinal side effects such as bloating or early satiety. Drugs can also cause changes in bowel function that can lead to constipation or diarrhea. Narcotic agents such as codeine and morphine cause a non-productive increase in smooth muscle tone of the intestinal muscle wall, thereby decreasing peristalsis and causing constipation. On the other hand, use of certain drugs can lead to the destruction of intestinal bacteria, leading to diarrhea. Causes taste changes. Several drugs can cause an alteration in taste sensation, reduced acuity of taste sensation, or leave an unpleasant aftertaste, any of which can affect food intake. Common drugs that cause alteration in taste sensation include the antihypertensive drug captopril, the anticonvulsant phenytoin, cause dry mouth, xerostomia, lack of saliva makes it difficult to masticate and swallow foods, especially those of a dry or fibrous consistency. Dry mouth immediately causes loss of taste sensation. If dry mouth condition prevails for a long term, it can cause dental caries and loss of teeth, gum diseases and nutritional imbalance and undesired weight loss. The drugs to watch out in this case are anticholinergics, which include tricyclic antidepressants such as diphenhydramine, antihistamines, e.g. Benadryl, and antispasmodic bladder control drugs such as oxybutynin, ditropin. These anticholinergic drugs compete with the neurotransmitters acetylcholine for its receptor sites, thereby inhibiting transmission of parasympathetic nerve impulses. This results in decreased secretions, including salivary secretion causing dry mouth, cause sore or painful mouth. This is a common side effect of chemotherapy and can significantly affect food intake. Antineoplastic drugs used in chemotherapy for cancer affect the mucous membrane as well, causing inflammation or mucositis. This may manifest as stomatitis, mouth inflammation, glossitis, tongue inflammation, or cheilitis, lip inflammation and cracking. Confusion. Drugs which impair memory or cause confusion can result in people forgetting to eat. Central nervous system side effects can interfere with the ability or desire to eat. Drugs that cause drowsiness, dizziness, ataxia, confusion, headache, weakness, and neuropathy can lead to nutritional compromise, particularly in older patients and chronically ill patients. From our discussion above, it must be evident to you that any of these problems, which are mentioned above from dry mouth to gastrointestinal irritation to constipation or diarrheas, can negatively affect food intake and absorption and thus have an impact on the nutritional status of the patient. This is one side of the coin. You must understand that drugs may also increase food intake. This is because they can stimulate appetite. This is a common side effect of corticosteroids, insulin and psychotropic drugs, and induce cravings for particular types of foods, particularly carbohydrates. Some psychotropic drugs have this effect. Next, let us learn about the effect of drugs on the absorption, metabolism and excretion of nutrients. Drug effects on absorption. Many drugs can impair, prevent or reduce absorption of nutrients due to formation of insoluble complexes. Many drugs can chelte with minerals and trace elements. Example, antibiotics ciprofloxacin and tetracycline form insoluble complexes with calcium, magnesium, zinc or iron, thus preventing or reducing the absorption of these vital nutrients. Competition for binding sites. Example, salicylate drugs such as aspirin competes with vitamin C. Damage to the absorptive surface of the intestinal mucosa. Drugs used in chemotherapy can cause villus atrophy, resulting in malabsorption, lack of bile acids. The absorption of fat-soluble vitamins such as vitamin A, D, E and K will be impaired by bile salt-binding drugs such as cholestyramine. Increased intestinal mobility. Drugs which cause diarrhea or stimulate peristaltic activity may result in nutrient losses. Drug effects on metabolism. Drugs can affect the metabolism of various essential nutrients in the body. These impairments are highlighted herewith. Carbohydrate metabolism. Hypoglycemic drugs such as insulin and sulfonylureas are prescribed because of their ability to increase carbohydrate utilization, and their action has to be balanced with carbohydrate intake in order to maintain glycemic control. Other drugs such as oral contraceptives and corticosteroids have adverse effects on carbohydrate metabolism and worsen glucose intolerance. Lipid metabolism. Some drugs are used to correct lipid metabolism, whilst others, such as chlorpromazine and phenobarbital, can induce hyperlipidemia. Vitamin and mineral metabolism. Micronutrients are required as cofactors or coenzymes in many metabolic pathways, including those by which drugs are metabolized. Increased activity of these pathways because of drug metabolism may therefore increase micronutrient requirements. Drugs can also compete with or inhibit the metabolic conversion of some macronutrients to their active metabolites, particularly folate. Methotrexate, used in the treatment of some cancers, directly antagonize folic acid metabolism by inhibiting the activity of enzyme dihydrofolate reductase. Similarly, anticonvulsants impair vitamin D metabolism with consequent disturbances in calcium metabolism, which adversely affects on bone dietary components. Drugs may also affect the metabolism of dietary components such as MOI, as we have discussed earlier in section 7. 3. Finally, let us get to know how drugs can have an impact on nutrient excretion. Drugs' effects on excretion. Use of certain drugs can influence the excretion of certain substances. For example, besides their intended increase in sodium excretion, diuretic drugs can also result in enhanced losses of other elements such as potassium, calcium, magnesium and zinc. Tetracycline increases the urinary excretion of vitamin C. So far, we have covered the relationship or the interaction of drug with nutrients and the effect of food on drug absorption, metabolism, utilization and excretion. Let us now move on to the study of the effect of a drug on the other drug, i.e. the drug and drug interaction. 7.5 Drug and drug interaction. In the discussions above, we reviewed the effect of food on drug metabolism. Interestingly, not only can drugs interact with food and alcohol, they can also interact with each other. Some drugs are prescribed together on purpose for an added effect, like codeine and acetaminophen for pain relief. However, other drug-to-drug interactions may be unintended and harmful. Prescription drugs can interact with each other, or over-the-counter (OTC) drugs such as acetaminophen, aspirin, etc. Sometimes, the effect of one drug may be increased or decreased. For example, tricyclic antidepressants can decrease the ability of a hypotensive to lower blood pressure. In other cases, the effects of a drug can increase the risk of serious side effects. For example, some antifungal medications can interfere with the way some cholesterol-lowering medications are broken down by the body. This can increase the risk of a serious side effect. We hope this brief discussion may have helped you understand the interaction between drugs and their usefulness and ill effects. With this, we end our discussion on the interactions between drugs and nutrients, drugs and nutrients and drugs. Let us check your understanding of the subject so far. 7.6 Clinical significance and risk factors for drug-nutrient interactions. We are already aware of the fact that poor nutritional status can impair drug metabolism, and the drug treatment can have a detrimental effect on the nutritional status. Not all drug-nutrient interactions are clinically significant. In many instances, any losses in nutrient availability or drug action will be small in scale and may be of short duration. Drugs, which are most likely to have diuretic implications, are those which have a narrow range between therapeutic effect and toxicity, need to be taken for a prolonged period, have implications in terms of the timing of food intake, necessitate dietary restrictions or regulation, have side effects which influence appetite or gastrointestinal function, and compete directly with a nutrient. People who are at risk from drug-nutrient interactions are the persons who have a poor diet, or in other words, have a poor nutritional status. Existing malnutrition places patients at greater risk. Protein alteration, particularly low albumin level, as you may recall studying earlier, can affect drug disposition. Persons who have serious health problems. Patients with active neoplastic diseases, cancer, or active acquired immunodeficiency syndrome, AIDS, with significant anorexia and muscle wasting are at special risk. Body composition. This is an important consideration in determining drug response. In obese or older patients, for instance, the proportion of adipose tissue to lean body mass is decreased. Accumulation of a drug and its metabolite in adipose tissue is greater and may result in prolonged clearance and increased toxicity. Fetus, growing children, pregnant women, these individuals are at high risk for drug-nutrient interaction. The physiological changes that occur with age, such as a decrease in lean body mass and body water, fall in plasma protein concentration, and a general decline in renal and liver function, mean that the risk of adverse drug reactions is much higher. Elderly people are also more likely to be given the types of drugs with powerful effects and which are most likely to have an impact on nutrition, e.g. cytotoxic drugs, anti-Parkinson's drugs, and antidiabetic drugs. Diminished salivation may make it more difficult to swallow tablets, and esophageal motility disorders may lead to bulky drugs sticking in the esophageal mucosa. Other problems such as failing memory, poor hearing and vision, and difficulty with opening containers may mean that drug regimens are not followed correctly, particularly if they are complex. Many of these factors are likely to coexist in elderly people, persons taking 2 or more medications at the same time, persons using prescription and over-the-counter medications together, persons not following medication directions, persons taking medications for long periods of time, persons who drink alcohol or smoke excessively. Now that we are aware of the clinical manifestations and the risk factors involved, it is important that we use the drugs wisely and lower the risk of drug-nutrient interaction. To help you do that, here are some handy guidelines. 7.7 Guidelines to lower risk and wise use of drugs. There can be no two views regarding the fact that the management of many diseases require drug therapy. However, they must be taken properly to ensure that they are safe and effective. Many medicines, as we have learnt so far, have powerful ingredients that interact with the human body in different ways, and diet and lifestyle can sometimes have a significant impact on a drug's ability to work in the body. To help you in this task and equip you to take wise decisions, here are a few handy guidelines. In fact, you may want to advocate these guidelines to the patients as well who shall come to you for dietetic advice. Guidelines to help use drugs wisely. By now, you are aware that the interaction of foods and drugs is a complex problem. Researchers cannot always predict whether a new drug will react with a food or if a drug that has been in use for some time will react with a new food. Moreover, you, as the consumer, cannot be expected to know everything about the drug. Then, what can we do to get the greatest benefit from drugs with the least risk? The following guidelines will assist us in preventing